My research focuses on health systems reform, including adoption and introduction of universal health coverage across many different countries around the world, including Latin America, of course. I've had the privilege and opportunity of working in Brazil for many years, especially in places like Ceará, in Fortaleza, and now I've been collaborating with Pan American Health Organization as well as many colleagues across the country to look at the achievements of SUS as a health system, targeting large proportion of the population, but also the challenges that SUS faces given the economic, political, and other transitions such as demographic transition as well as epidemiological transition that has brought new illnesses, especially chronic illness. SUS is very important, first as a construct, because it was conceived as a right to health for citizens. It was part of the democratization process in Brazil. It gave hope and it gave opportunity. It also gave many rights to individuals to realize their health rights and improve their health outcomes, provide financial protection. So as a system, as a construct, as a conception is critically important. But what was also very important is that SUS was able to move beyond concept. It was actually able to implement really wide-ranging reforms, focusing on primary health care and community-based care, true to the principles of Alma-Ata Declaration, to provide a comprehensive set of services for those most in need, and now covering more than 70% of the population, in excess of 100 million people. So it's one of the few systems that has been able to move from concept to reality with incredible outcomes. SUS covers more than 100 million people. But the question is, can it be sustained given the economic and political crisis that Brazil faces? I would hope that it can be sustained, but what's important that politicians and everyone in the country really works to protect this important achievement. Well, SUS is universal, and SUS also it has a number of other important features. The first is the way it's organized. It enables collaboration and an inclusive approach through the health councils at municipality level, but also at state level, and also at the federal level, with the tripartite system that Brazil has in terms of governance. Financing is also quite innovative. Financing comes from municipality, state, and federal level, so there's a balance, there's a solidarity. But the most important innovation and important aspect of SUS is the way it was conceived in terms of what is delivered. So it combines healthcare services with public health, integrated into a single whole, and focusing on the individual, the family, and the community. Universality is important because one of the important objectives of any health system, and for those of us working in global health and in the area of health systems and health policy, is to achieve equity, both equity in terms of access to services, but also equity in terms of health outcomes in relation to financial protection, but also satisfaction of the service users. And one of the most important underpinning principles of SUS is equity. Now, why is this important, especially in the context of Brazil? Because Brazil is one of the most unequal countries in the world in terms of income inequalities. Although in the recent years, thanks to the reforms such as Bolsa Familia and others, there has been a decline in the level of inequality. Still, the levels of inequality are quite high. Some of the, one of the highest levels in the world, and that's not just common to Brazil. It's the future of Latin America, unfortunately. with the economic crisis, there's a risk that the gains that have been made will be lost, and these inequalities will begin to widen. And that is not good for individuals, for their families, for the population, but also not for the security of the country, because that's a source of social unrest in any country. I think there's much to be learned from SUS, the way it's designed in terms of governance structures, in terms of financing. Very important, the service delivery is inclusive nature. And I think there are many features that will be important for other countries. Again, any country has to develop a system that is specific to their context, but I think there are important lessons to be had from SUS. And for me, one of the most important features, as I articulated earlier, is the big focus on the individual, the family, and the community, and the integration of healthcare services with public health interventions. And the outreach that SUS has been able to achieve through the family health teams. The family health strategy is a very important feature that many countries can learn from. We're leading several studies in relation to Brazil and SUS, and this particular one explores the achievements of SUS over 30 years since its inception. It looks at achievements in relation to health outcomes, in women, children, in infectious diseases, but also in relation to chronic illness, which is a problem, a challenge that Brazil faces. Then the study will explore the current challenges and the future challenges, and will analyze how ready SUS is to manage these future challenges and the risks it faces in relation to sustainability. Then we'll develop a set of scenarios to see what needs to be done in terms of policies to mitigate these risks, to ensure sustainability, and to protect a very important achievement. There's much to celebrate. SUS exists. It provides services to more than 100 million people. It has achieved great health outcomes. It has helped to achieve great health outcomes in relation to reduction in maternal mortality, reduction in infant mortality, reduction under 5 mortality, very good improvements in relation to many infectious diseases. It has provided healthcare access to millions of people, especially the poorest and the most vulnerable in the country. It has provided services in the regions, in the states where services were very poor. So there's much to celebrate, but one must not be complacent. One has to build on these successes and ensure sustainability going forward.